In 2016, some 4 years ago, the World Health Assembly had a resolution, and it was to combat ageism because member states in 2016 recognised that it was a prerequisite to combat ageism to develop good policy on healthy ageing and improve the day-to-day lives of older people. We know that, and many of us on the call today, have felt ageism, have really reflected on our age and the value we could make in community. So it's not something that belongs to another generation. Many of us at this town hall actually live with and confirm ageism in some of our attitudes, and that's what we call self-directed ageism. But we also know from evidence, and there's not a lot of evidence, but from some evidence that ageism negatively impacts mental health and functional ability, reducing life expectancy by up to 7.5 years on average. So as we continue to live in the world of a pandemic, it really is an important time to sort of dip back into the impact of ageism, but also what's being done, to combat ageism. And so we have the pleasure conversation today with Dr. Jane Carmody from the John A. Hartford Foundation, and also with Mr. James Appleby of the Gerentological Society for Aging. So let me just make the statement that we welcome both Jane and James to be with us today, and also robust discussions and comments from all of us on the town hall. Jane is a program officer at the John A. Hartford Foundation, a national private foundation dedicated to improving the care of older adults. And I must just say that there are not too many foundations in the world that are dedicated to this area. So really it is quite unique. James is the Chief Executive Officer, as I said, of the Gerentological Society of America, the US's largest interdisciplinary organisation devoted to research, education and practice in the aging field. While Jane and James will talk about what's going on in the United States, we really want to explore how some of the work of the GSA and the Hartford Foundation, can be used in principle in other environments. So thank you both of you for being on the town hall today. And I hand the floor to Jane Carmody. Welcome.
Thank you and good morning. Thank you, Dr. Barratt, and to the IFA team for having us here today. It is really an honor and a pleasure to be here to talk about the foundation and ageism. After learning about IFA Fridays, early morning 7 a.m. town halls. Of course, that's 7 a.m. in New York time. I try not to ever miss. I am humbled by the good works and around the world addressing such big challenges. And I hear dedicated people from all over the world asking the right questions and talking about ideas for a better world for all of us. Jane thought it might be good to a little bit about what we do and how we do that. At the foundation, I am a nurse, and I came to the John A. Hartford Foundation with a lot of experience caring for older people and supporting those who care for them, the staff and the clinicians and the families. Over the years, I've implemented programs and models to improve care. I've served in leadership roles in hospitals, nursing homes, home care, hospice, and in executive system leadership roles. I know about the foundation because many of the programs we implemented in our hospitals and clinics were started or at one time funded by the foundation. I remember thinking, who are these people that care about older people? Well, these people, to start with, were John A. and George Hartford. They were brothers who started the foundation in 1929. John and George owned A&P grocery stores in the United States, I think about 3,000 of them. And when they established the foundation, they had an overarching directive, and that was do the greatest good for the greatest number. Over the years, this greatest good evolved to the focus on older adults. In the past 30 years, the foundation has funded over $600 million in developing nursing, physician, and social work leadership. in geriatrics, helping to develop and define and create the field of geriatrics in the US. And then about 5 years ago, the foundation selected a new president, and that's a nurse, Dr. Terry Fulmer. She wanted to take the research and education that had been funded over the years and actually take it off the shelves, as she says, and put it into place, put it into practice to benefit the greatest number. Dr. Fulmer is well known in the US and respected for her life's work in caring for older people. For example, she developed and implemented a program called NICHE, which is Nurses Improving Care for Health System Elders, now with over 700 sites. And Dr. Fulmer is also well known for her important work in elder mistreatment. Our VP of Program is Ronnie Snyder, who oversees all of our grant making. Ronnie has more than 30 years in philanthropy in improving lives of older people. She did her doctoral work in family caregiving at UCLA. And then our skilled and dedicated team includes nurses and a lawyer and various experts in all aspects of healthcare, public health, and community services. So at our foundation, our grantees funds, we also guide and support our work and advocate for the grantees' work. We fund only in the United States. We do not accept unsolicited funding requests. So we're always assessing and seeking programs that deliver on our mission. Grant making is always hard because there's so much need. Our board and leaders are very careful about grants that keep us aligned with our mission and priorities. Collaboration is in our DNA, and we partner with public and private organizations and other funders as we believe a collective voice and relationships take us farther. The John A. Hartford Foundation mission, as Jane already said, is wholly dedicated to improving the care of older adults. And we do this in 3 ways: through age-friendly health systems, family caregiving, and serious illness and at the end of life care. For example, in age-friendly health systems, we now have over 800 hospitals and physician offices and 1,100 pharmacy clinics acting on the 4 M's. Those 4 M's are what matters most: medication, mentation, and mobility. We also provide and support care for geriatrics, emergency care, and surgery care. We are partnering with Trust for America's Health in the US is an advocacy group for public health to create an age-friendly public health system. And we support work to strengthen and build the capacity of community services. So we are aligning healthcare, public health, and community in our work. And we appreciate the World Health Organization and the AARP in their Age-Friendly Communities Network, which now has more than 500 designated communities in the US. In family caregiving, we're working with our government to support national policies and practices for family caregivers. And we have a special focus on 3 of our grantee programs for caring for for families caring for someone that's living with dementia. In serious illness and end-of-life care, a main focus of our work there is spreading palliative care all over the United States. As Jane said, we are only one of 6 foundations, and I think there's like 100,000 foundations in the US that is totally focused on improving care of older adults. Now, other foundations, of course, will have programs on this, but this is our whole mission. The foundation is very transparent. All of our grants, grantee names, and funding amounts are listed on our website. With COVID-19, the foundation assessed plans and investments, and we let our grantees know that we will continue funding as pledged and understand the delays that they might be experiencing. So far, the foundation investments are strong, which is kind of interesting in the United States, and we hope it stays as such. Also, in response to COVID, the board quickly approved funding for new work on improving nursing home care, both in immediate steps as well as for the long term. The foundation also pledges to fight racism, ageism, and other injustices that prevent us all from living in a nation where we can age with dignity. We know disparities and inequities do not improve with age, and we require all grantees to address disparity, equity, and inclusion in their work and in their outcomes. One common theme we find that can impact our work to improve care for older people is ageism. This underlying thinking and assumptions can impede policy and practice, and the foundation was one of the group of initial funders supporting research and now action to change thinking about older people. After all, we all age and we're all in this together. So on that note, I introduce James Appleby.
Thank you very much, Jane, and thank you, Dr. Barratt, for the opportunity to be here today for the town hall. I'm delighted to have a chance to have this interaction and to share with you some of the work that the Gerentological Society of America, in collaboration with many other organizations here in the United States, is doing around the topic of reframing aging. As noted in my introduction, I do serve as CEO for GSA, and for those of you who aren't familiar with the organization, it's individual membership organization of experts in aging. The members come from not only the United States, but 54 other countries as well, so it has international reach. It has representatives from every discipline you could imagine that might study aging, so not just biomedical, but psychosocial, economic issues, housing issues, etc. And we take a life course perspective, which is important because the issues that we all wrestle with when helping support older people, they don't just develop at any particular age, but they develop across the life course. And individuals across the life course can help us in addressing, in particular, the topic of ageism, which is what we'll be addressing primarily today. As noted, the COVID-19 pandemic has really been accompanied what could only be called an outbreak of ageism, and the focus on older adults that COVID-19 has brought has really highlighted that ageism is indeed very much alive and well. As we know, this insidious societal attitude towards older people is well entrenched in many cultures, and certainly well entrenched before Dr. Robert Butler, the first director of the National Institute on Aging, coined the term ageism a little over 50 years ago. Frustration with this entrenched ageism is really what drove GSA, together with 7 other organizations, to get together and say, how can we collaborate to try to address it? And the reason it's an issue is that advocacy organizations, when trying to get their point across to policymakers, run into the inherent entrenched ageism that exists when they're trying to have conversations about policies which would improve the lives of older people. So these 8 organizations, so it's GSA together with AARP, with the American Federation for Aging Research, American Geriatric Society, National Council on Aging, National Hispanic Council on Aging, and Grantmakers in Aging and the American Society on Aging got together and said, look, we can find a way to collaborate to address this issue of ageism, which undermines our collective efforts. And the idea we came up with was to reframe, to use the phrase of the day, the public's understanding of what aging is really about. Because research has shown that how the public views aging, that what I'll call conventional wisdom, is very different from what scientists know to be true and from what aging advocates know to be true about aging. And it's that disconnect that often causes and continues to perpetuate the entrenched ageism that we're up against. And it frankly harms our health, as Jane mentioned in the introduction. Ageism is bad for our health, and it's something that others in many ways do to us. That is, the attitudes that others have about aging impact the health and well-being of the older adult population. So I'd like to take a few minutes and introduce you to this new, what we call Reframing Aging initiative. It's a long-term social change endeavor, and we're trying to change the public's understanding of aging. Now, changing culture is not a simple undertaking, and we refer to it as a generation's work. We believe that the right time horizon to look at in understanding how we're having an impact is probably a good 20-year time horizon. So certainly the decade of healthy aging and another 10 years after that, I think, will be needed before we can have the sort of meaningful change in society attitudes towards aging that we're all hoping for. For our conversation today, I think a couple of things are important to note. One is this research was done, and I'll share with you, and the programs that have been developed were done in the United States. So it was done inside the cultural norms towards aging that exist here in the United States. So while some aspects of this program may be generalizable to other countries, the fact is I think that any work in other countries would really need to be supported by net new research, net new testing of interventions, and a net new sort of implementation strategies. It's important to realize that. It's also worthy of noting what reframing aging is not. Reframing aging is not a matter of sprinkling some words into our communications and somehow that's going to change public perception. It's not a script. It's not a campaign such as just say no to drugs, which was a campaign years ago here in the United States. Now, what reframing aging is really about is a deliberate, thoughtful way for advocates to structure their messages, that is, structure how we say things so that we activate the right cognitive models in the minds of the listener so that it will help the listener then want to be supportive of aging-related issues. So it's a strategic communications approach over time. We're not going to do it for a week or for a month. It has to be a sustained change in how we talk about aging that will ultimately enable us to increase public understanding of aging, over time shift how we talk about aging, and at the end of the day, we hope, shift how policymakers make decisions around aging. I do want to acknowledge the funders that have made all this possible. The John A. Hartford Foundation, the lead funder, has provided enormous support for getting this program launched, and thank you, Jane, for the John A. Hartford Foundation support. Also, the RRF Foundation for Aging, the Archstone Foundation, and the SCAN Foundation have provided meaningful national support to stand up this program. So you're all well aware of the negative impact that ageism has on older people's health, on their self-perception, their well-being. The good news is that research shows that interventions to address ageism can work. So the research is there. There have been recently published meta-analysis of different interventions that show that they work. So there's good news out there. The issue is, can we harness those interventions and apply them in a systematic, consistent way over time in order to shift how the public thinks about aging and to address ageism? Now, we use the phrase reframing aging and the word framing quite frequently, and I want to say a word or two about what a frame is. A frame is really about how you decide to describe an issue. That is, what words you use to describe it, what values go into that language, what explanatory metaphors you might use, what solutions you might put into it. But a frame is all about what you put into the message, as well as what you leave out. And I suspect many of you have had the situation where you're like, something happens, you're like, how are we going to frame this to the boss? How are we going to explain what happened in a way that captures the nuances, that focuses in on what's important and leaves out what's not? And that's what framing is about and what we're trying to do with this Reframing Aging initiative. The reason we need to be thoughtful about our language is because all of us come to interactions with certain cognitive models, things that have been built up over the communities we were raised in, the education we achieved, the culture in which we're brought up. And those cognitive models mean that you can cue when talking to people, when messaging in particular around aging, you can cue messages which are cognitive models which help that person embrace what you're saying. And you can also cue cognitive models which frankly get in the way of the message you're trying to transmit. And it's not at all uncommon for advocacy organizations to be stunned by how they say one thing and they realize that the recipient has heard something quite different because of the cognitive models through which they're viewing the message. Here in the US, the research that we've done looking at how the public thinks about aging, we refer to that as the sort of swamp of public understanding. And here in the United States, a lot of these cognitive models that are getting in the way have to do with issues around deeply entrenched individualism that makes it difficult to have conversations around aging, because we know that aging is not just about the individual, it's about the context of aging, it's about the surrounding society. Issues around fatalism are in the swamp of public opinion as it relates to aging. Can we really do anything about it, they say? Us versus them is an issue that's in the swamp of public opinion. That is, people refer to, and I know all of you have heard this before, they, referring to older adults as if it's a completely different species. They otherize the older adult population. So that's something we wrestle with. And then one may be surprising to some of you, one surprising thing we wrestle with here in the US at least is a complete cognitive hole, as the researchers call it, around ageism. That is, the public doesn't even realize how ageism on their radar screen, as it were. It's not part of their thinking. So we did extensive research. The research underpinning this Reframing Aging initiative included more than 12,000 participants, and they were involved in one-on-one interviews, in focus groups, on-the-street interviews, online tools and methods as well. So it's very evidence-supported, these interventions. And the interventions they tried probably 10 or 12 different ways of talking about the issue of aging. And I'll just tell you that the two sort of overarching concepts that came out, and going through essentially here in about 10 minutes what typically we go through in a day or two training program for facilitators. But two big platforms of messaging came out as being effective. One built around reinforcing the issue of ingenuity and how we problem solve. And by problem solving is how we can collectively work together to improve the lives of older adults. And another messaging platform is around the issue of justice and how in America, not everyone has a just shot at success. And in particular, we don't treat older adults with justice. We don't enable them to have a fair shot. And there are steps that we can take to address ageism that will help ensure that older adults can be full participants in American culture. So those are two broad platforms. And all of this is outlined in great detail on the Reframing Aging website that GSA has stood up, and you can have access to all this information. It's freely available. I'll just quickly say that over the past year, GSA and our 7 other colleague organizations have been working very aggressively to engage at the national level and at the local level. We have trained facilitators nationwide who provide workshops around reframing aging, first in person and now transitioned to an online format. We have worked with state governments, with federal governments. We're having a dialogue with private industry to see what they can learn about reframing aging. We've worked to change the style guides used by the American Medical Association, the American Psychological Association. Those are style guides for journals, as well as the Associated Press style guides. So we're doing systemic work that will have a long-term impact. And then we're also working with aging organizations who are hosting conferences, for example, to make sure that as part of the submission process for symposia, that the reframing aging principles are included and required for submitters to consider. Likewise, peer-reviewed journals, and GSA has 6 peer-reviewed journals, are requiring that authors acknowledge the importance of the reframing aging principles and the language that should be used to most appropriately talk about older people. So we're very excited about how this is unfolding. We can, again, provide access to all these different resources that we hope you'll avail yourselves of. And if there are some takeaways from it that you find valuable, we hope you'll be able to perhaps repurpose some thoughts. We could also get you in touch with our research partner, the Frameworks Institute, if you want to consider trying to do research inside your particular country about how you might stand up a reframing aging initiative at home. Jane, I'll turn it back to you at this point.
Thanks very much, James, and also Jane, and we welcome questions. So I want to go back to what I think is one of the unique points of distinction about your work and the work of your colleagues. First of all, you've actually got 8 organisations coming together around a common issue. I think that is unique in itself, so congratulations. I think also that you've had a number of funders. So really what I see is that there's an opportunity to collaborate across sectors and across disciplines. And that is a model that I know we must be using as we go forward in the decade. I want to loop around to what you were talking about in terms of the cognitive model and the communication. And, one of the phrases that you used was, it's about the individual and the context, and then make the leap to age-friendly cities and communities. So could you make a comment about the value or not around age-friendly communities in the context of combating ageism?
Absolutely, Jane, and I think that's a perfect example. Indeed, this issue of the individual is one of the things that we work against in the United States, that there's a strong belief that somehow it's all up to whatever the individual chooses, and the individual gets blamed for, well, they didn't eat right, they didn't exercise enough, they didn't take care of themselves, etc. When in fact, experts know that aging is very context dependent. What surrounds us shapes us, and that's an important point to bring forward, and to make sure we're talking in terms of we can work together to improve the lives of older people, for example. And I think the age-friendly community movement is a perfect example of that. We are all in this as a collective together. Aging exists on a continuum. I'm amazed that I often believe that younger individuals don't realize that they are just younger versions of their older selves, right? And the whole age-friendly movement, whether it's age-friendly communities, age-friendly universities, I think is very powerful. It's exciting to see how it's continuing to grow.
So, James, I also want to go back and speak around the justice issue. Because I think rightly or wrongly, when we talk about ageism, we also talk about abuse and neglect at the same time. And there is a connection, but you can have these separate conversations. How is the work around reframing addressing the justice issue?
Wonderful question, Jane. And indeed, the justice issue emerges on multiple fronts. One is when talking about ageism, it's best to frame it as a justice issue, that as a result of ageism, we're preventing certain parts of the population from fully engaging in American culture. So that's one place where the justice narrative can be deployed. The other, you mentioned elder abuse. In fact, there is a colleague project going on right now through the National Center on Elder Abuse, which is at the University of Southern California. And the GSA work around reframing aging collaborates closely with the National Center on Elder Abuse. And they have launched a program reframing the conversation around elder abuse, and justice is a big part of the platform upon which they're building their work as well.
Okay, look, thank you. And I just want to just encourage people to put your questions in the chat box, but also note that there's lots of resources already going into the chat box. I'm going to ask a question on behalf of Dan, and then ask Eileen to ask a question. And I think Dan's made a really interesting question. Dan works on an aging file with federal corrections in one of our close neighbours. And the question is, has GSA done any work around combating ageism in correctional environments?
Well, none of the research that was being conducted with those 12,000 participants, none of that included individuals in correctional environments. However, a number of the aspects of what we've learned around reframing aging and what works, I think, can certainly be applied. And for successful aging, indeed, it is not just up to the individual, it has to be up to the system. Right? And I think that if you consider that, you would ask the question around, well, what system changes will we need in correctional institutions to help make it possible for individuals to age successfully? So it's not just up to the individual, but very much up to the system. In many ways, that dramatizes the impact and the fact that what surrounds us shapes us in a very stark manner.
And also perhaps, you know, we need to be thinking about, you know, equity. You know, we've got correctional environment, older homeless people, older migrants, older women, older refugees. And it seems to me that the layers of jeopardy together with ageism impact these people in a very different way. So Eileen, welcome. Where are you, Eileen? Would you like to come forward?
Good morning. I had to unmute and I had to put on my video, and I'm having problems with my internet. We had storms here, Storm Ellen. My question is, thank you very much for both introductions and your own introduction. There's great work going on in the GSA. Just one question and an observation. Did the research have a questionnaire that individuals can use themselves, even the researcher, as well as the person filling it out, that individuals can use to determine their own bias and stereotyping of ageism, and particularly to address self-directed aging as a sort of a takeaway? Because in a workplace, you do these stereotyping for jobs of gender-based jobs, etc. And even the definition of gerontology is the scientific study of old age, the process of aging, and the particular problems of old age. So even the dictionary has problems. So immediately people go to problems. And we in Ireland, we recently had extra restrictions, and we've headlines that I don't know if I can survive another lockdown, says a lot of anger being expressed by older people. Thank you.
Thank you, Eileen. James.
Yeah, wonderful question. In terms of the research, as part of the process, there are many different aspects to it, and each different research methodology was getting at a different aspect of the program. They did not do detailed analysis of the particular ageist attitudes of any particular individual. However, those sorts of assessments, in fact, there's one available through the GSA website, are out there, so that individuals, and I encourage all of us, and it's very self-enlightening, let me say that, to go and take those assessments, and you can find one available on the GSA website on the Reframing Aging pages, and I encourage you to do that. I think it'd be a good start, and you may, perhaps one of the action steps after this would be to encourage others to do that. Becoming self-aware is sort of an important step along the way as we're all trying to collectively address ageism.
So James, talk with us a little bit about growing up in society and ageism. You know, we know that intergenerational interventions are, you know, some of the most effective in combating ageism. But when do we start talking to children about ageism? Or is it youth? Or is it, when is it? Would you be talking with them about it?
Well, in terms of when to begin talking with children about it, I think it's more a question of making sure we're all aware that even as infants, children begin to be exposed to ageist attitudes, and of course, and again, I want to be clear, I'm talking about a U.S. context, but early on in life, children are exposed to these different attitudes, and that helps to shape then how they view aging and ageism. And I suspect many of you have had similar experiences throughout your lives as well. So it starts early in terms of children's being exposed to ageist attitudes, and then beginning to incorporate some of those into their perhaps own thinking about what aging is about. So I think the earlier we could start having conversations, the better. But it may seem a bit abstract to to children to have a direct conversation about it versus just avoiding demonstrating ageist attitudes and behaviors by parents. If the children don't see it and aren't exposed to it on a regular basis, then that perhaps puts them in a better place going forward to avoid developing strong ageist attitudes.
You know, I think it also, you know, it's fundamental to the way that we grow up, isn't it? You know, we talk about a life course approach to aging. You know, perhaps there's a life course approach to combating ageism, because, you know, I mean, in any family, well, that's, you know, that's Nana. You know, Nana can't do this, and Nana, all I get from Nana for Christmas, you know, is the coat hanger that she's made. You know, it's kind of like intrinsic to sometimes the communication of family.
It is, Jane. And I would say that I might refer to some of these things as throwaway lines. We don't really think about them.
Yeah.
But I encourage all of us to think about them. And my colleague Trish D'Antonio, who's on the call, Trish is actually director of the Reframing Aging Project here at GSA. She reminds all of us, you know, birthday cards might seem innocuous, but it's really not funny to say, oh yeah, here's a birthday card. Say, oh, you hit 50, it's all downhill from here, or whatever. So there are all sorts of small things that we do. And again, throwaway lines or things that if we really self-reflect, we realize, you know, that's not helping. And in fact, that might be actually contributing to advancing ageism. Even though we know better intellectually, changing our behavior to avoid those ageist acts is a different matter.
Well, perhaps we need a hallmark on the line, because I'm sure if we stopped buying cards that had any relationship to, you know, that was contradictory, then the business would actually need to change its model. I'm going to call on Kathleen Brasher, and Kathleen, you're a trooper from rural Victoria. It's always late there. And then Christine Cobus. So Kathleen Brasher.
Thank you, Jane. Yes, it's late on a Friday night. So thank you so much. I'm delighted to be able to actually hear Jane Carmody and James Appleby speak, because I'm a great follower and supporter of the work, both of the John A. Hartford Foundation and the reframing work. The New England Journal of Medicine recently published a paper showing that left digit bias exists strongly in medical specialists. The work was done in the US, so that if your birth date was 70 and 3 months, you were treated very differently than if it was 69 and 9 months, and that this had negative outcomes for those patients who were treated differently on the basis of their left digit. So I'm just wondering what work is happening directly with medical specialists.
Wonderful question, Kathleen. And indeed, it's very true based upon research we've seen that in particular for individuals under very stressful situations, perhaps in medical care, that, you know, they have to have cognitive shortcuts to make decisions quickly, because often they can be life and death. And sometimes, and one of the things we are really been very vocal about is that you cannot use age as a criteria, for example, for resource allocation. Not age alone as a criteria for resource allocation here in the middle of the COVID-19 pandemic. So that the recent research article you're talking to is indeed something we're familiar with. There has been just last week, in fact, and I direct everyone on the call to it, a webinar that focused on reframing aging with a special lens on health professionals on the front line, interacting with patients, with families, with caregivers. And I'd encourage you to go. The webinar is recorded there. The slides, if you just want to look at those first, are also available there. But that very topic was just addressed last week in a webinar, and it's definitely worth checking out.
You know, just on that point around COVID, James, you know, IFA is really on the front in the fight to ensure that the clinical trials for the COVID vaccines, you know, are very specific across all ages, and particularly in those in the older age group and vulnerable. You know, the recruitment is disaggregated because we know that clinical trials for new vaccines rarely focus on the disaggregation, and that comes back to data and evidence. So we've got to look at ageism in a number of different lenses. So I'm going to call on Christine, and then Suzanne Brake, and then Anita. So Christine, did you want to come forward with your question?
I really didn't have a question. I was just putting a comment in the chat. I think that leading by example and by the way in which we all live as we age will make a huge difference. But I really liked your comment about Hallmark. I think getting them on board would be huge.
Well, look, I have nothing to lose, you see, so I like to be quietly disruptive. So I'll be on the on the internet after this to see what we can do around Hallmark, et al. So Suzanne Brake, welcome.
Hi, good morning from Newfoundland and Labrador, Canada. Thank you all very much for this very, very interesting conversation. I've been very interested in the whole idea of discrimination based on aging for just about my whole career. I love the comment about the Hallmark cards. When I turned 40, and I'm 63 now, when I turned 40, I threw a huge birthday party for myself. And one criteria was that I was not to get a birthday card. I didn't want gifts, but a birthday card that was in any way discriminatory or critical of me at this fabulous stage in my life. And it worked. People still are saying to me when they see me that it made them think twice, ever since then, about when they give this kind of a message to someone else. I just posted a little message there to say that I think too that we have to be role models. We have to act and behave in such a way which we are not reinforcing ageism as well in terms of how we think and how we act and how we behave. And every opportunity I get, I have 3 grandchildren, 2 are over in Denmark, and I'm in Newfoundland, but I do have 1 grandchild here in Newfoundland. And I was reading a book to him the other evening called Hundreds of Cats, Thousands of Cats, Millions and Billions and Trillions of Cats. And it was, first line was, a little old man and a little old woman were lonely and they wanted a cat. And so it was an opportunity to talk to my grandson about what does that really mean. And I wonder, could a young person or could his mommy and daddy, want a cat? And what would that look like? So I think every opportunity, and sometimes it's wearing and tiring for us as we grow older. And I know there are people here who may be older or younger than me, but I think sometimes we've really got to do that. The other piece is that when I did my PhD studies, I looked at an ageism attitude, the whole idea of why do some, students who study social work, why do so few students want to study and want to practice gerontological social work? Because in my life experience, it's been, there are just so few people that's where they gravitate towards. Thank goodness, as years have gone on, I'm seeing more and more people who do that have that interest, but I still think there are more and more students when they start off their career believe that this is an it's not an area of interest. So those are just a few things I wanted to add in. And thank you very much, Jane, for having these sessions. It's just fabulous.
Well, look, thanks, Suzanne, and you're an icon in Canada. So it's a great honour to have you with us from time to time. So thank you very much. And I particularly like the story about cats. So I'll take that one forward. I want to just offer the opportunity to Meg Teaford, because I think, Meg, you made a really interesting comment in the chat box.
Good morning. Sorry, I had to unmute myself.
Yeah.
Yes, well, I don't know if it's just in the US, but both my husband and I, and he's older than I am, are often referred to by sales clerks and other people as young lady or young man. Well, surprise, I'm not. and I'm proud of it. And but I have not really found a nice, gentle way, and I suppose that's my makeup, to say to them, "Is something wrong with your vision? What's wrong with you?" And so anybody who has a thought, I try sometimes to cheerfully say, "Oh, maybe you didn't notice I'm old enough to be your grandmother." But you know, it's just a very difficult issue. And just this morning I was thinking, well, maybe in the age of protests and George Floyd and Black Lives Matter, maybe old lives matter too. So that's just my thought on it.
It's interesting, isn't it, Meg, that there is a need to actually say young lady or old lady or middle-aged lady or old man. You know, perhaps if we just got that adjective out of the way and said
Yes.
good morning or good afternoon,
Yes.
you know, because that's an action in itself. So perhaps we could encourage that in the narrative. And thank you for your comment. Christine, I'd really like to for you to sort of share with you your intervention, which has made a difference in Dublin. Christine O'Kelly? All right, I'll come back to you, Christine. Okay, Cynthia Stewart.
Yes, thank you all. And I wanted to just give Jane Carmody perhaps an opportunity, because I know that the John A. Hartford Foundation did a lot of work in preparing professionals, particularly physicians, nurses, and social workers. And I know in the social work arena from which I come, they did a lot to educate the faculty of social work schools, which then translated to, as well as funding students to go into the field of gerontological practice. So maybe, Jane, you could share some outcome of that very pioneering research that the John A. Hartford Foundation did.
Thank you, Cynthia. I will say that, as I kind of mentioned, that in the past 30 years, what we did was fund and support the leaders in the field to create a field, to create interest in, I think, who said that, Suzanne, interest in geriatrics, interest in care for older people. And so all of that work really developed leaders. Today, we still have people that are leading work, leading care models that were funded and founded in their earlier years of work. Right now, the focus is, as our president says, so much of that work that was done is sitting on a shelf somewhere and not really impacting and benefiting the people that were intended to be. So that's really the focus of our work now. But we have all of this rich leaders in the field now to look at and to look at their work that's being done and implement it. I will say, I wanted to comment. One of the questions that came up when we were talking about this at our board, well, what about the general public? Aren't we teaching the general public about this? And as we said, well, we've got to really talk to the choir first, because anyone in the field of geriatrics that comes out with some of these same thinking and concepts and ageism themselves really defeats the purpose. All it takes is somebody to stand on the stage of 1,000 people and to say, well, the silver tsunami is coming. And really, you know, kind of put us all back. So we really work, you mentioned health professionals and the great webinar that GSA did, and I'm just so amazed every day and proud of their work, really focusing on health professionals. We do what GSA would call a frame check. Are we saying, are our words appropriate? Are our materials appropriate? And can really look at everything we say and do in materials. And so I appreciate that, Cynthia. We really feel like we have developed a huge field of people interested in improving care of older people. And now our work is to put it into place.
Okay, thanks, Jane. We have two final questions. Marg Gillis from ILC Canada, and also Man Veen. So Marg, welcome. Marg is the president and founder of International Longevity Centre Canada, and really is a driving force in terms of enabling the government here to be a leader in the discussions around the convention. So Marg, thank you.
Thanks. My question actually surrounds what happened to older people during COVID pandemic here in Canada, where over 80% of the deaths were in long-term care. And many of us, IFA, ILC, and other organizations in Canada are looking to push our government to make some really fundamental changes. But I think it's really fascinating to think about how we frame those messages. And you've brought this issue to the table today. Is there any advice for us in terms of how we frame that argument that change needs to happen? We're very worried that the government won't respond to this once the pandemic is over. And I also think there's an interesting piece that Jane just raised in her discussion in terms of when we talk about the Convention on the Rights of Older Persons, how we frame that argument to make sure we're actually changing ideas and changing the response to older people. So that's my question.
Thanks, Marg. We go on to Manveen, and then I'll ask James to respond. Manveen?
Yes, I'm actually I'm a caregiver for my grandmother in India. So recently she had to be hospitalized for like 2-3 months for multiple causes, and since then she needs assistance with her daily living activities. And over the months caring for her now, these attitudes of ageism have started developing in me, and I see it around in my family also towards her, because she's slow and she needs help. It is sometimes very frustrating for everybody, but then all of us end up feeling very guilty about it. Because we love her in the end. So I wanted to know, what can I as a caregiver do to combat ageism in myself and my family too? Yeah.
Thank you very much for that very thoughtful question, Manveen, and also Marg. James, over to you to respond.
Yeah, two wonderful questions. In terms of the work you're doing there in Canada, I would encourage you, as you're thinking about approaching different authorities, first of all, avoid blame, because what we really want to get to is to solution, to position the opportunity here as a way to solve problems. That's what we do, after all. We're in healthcare. We know how to solve problems. We've been up against this before. That's in our DNA, so to speak. To use the we approach. It's not us versus them. It's we together can solve this. And in fact, by coming up with new policies, we can improve the situation for individuals in long-term care facilities. We can improve the lives of the families who are concerned about those individuals, and we can improve the lives of the caregivers and workforce in those facilities. So it is a collective, and it's solutions oriented would be my recommendation. In terms of the work you're doing in caring for your loved ones in India, the fact you're thinking about the issue is 75% of the way there, I think. I believe you can take away even some thoughts from this conversation to apply. But in particular, pointing out or reminding people around the fact that your loved one may be older, but that's the only difference. They're just have more trips around the sun, so to speak. And that they deserve to be treated with dignity, respect, regardless of age, and to point out when you feel individuals, put out politely inside the family, I guess, but directly when you feel individuals are being ageist. And hopefully that can sort of emanate out, and they can apply it in their own lives and with their families as well.
Okay, thanks, James. And just as we wrap up now, I'm going to go back to Jane and James for their final comments. But in essence, this has been a very deliberate and thoughtful discussion that we've had this morning. Some things that I've learned is around the cognitive modelling that's been going on with this very important project. I think it's a body of work that can be replicated. The principles can be picked up, in any local situation. It's about the way that we understand it. I'm of the firm opinion that age-friendly cities and communities, the development of age-friendly environments is really a vehicle in which we can use this body of work. I think for me, now and going forward, it's really standing up and being present. You know, I need to be present to the issues and to be connecting and building bridges across sectors and across disciplines, because it's going to take an inclusive common agenda for this to actually gain traction. So I thank you both for a very thoughtful discussion this morning. But Jane, what is your closing message for everybody at the Town Hall?
Thank you so much. This has just been so great and learned so much. You know, one thing our president, Dr. Frommer, says, if it's about older people, I'm all in. And so the important message that we have, and I think that overlays everything we do, and if you get to the core of it, everything we're talking about, and that most important message is what matters most, regardless of where you are, who you are, but what matters most to me, to you, to your families, and how we want the world to be for all of us as we age. And that is the greatest good for the greatest number. I want to thank the IFA team and Jane, and of course point out that Lori and Trish are on the phone to support James. And James, this has just been a wonderful conversation. I will just say one note. We are now funding some work with frameworks around nursing home and reframing nursing homes. We are very interested in what we can do to improve nursing homes. We think it's, as our president has said, maybe we should close them and start over. I will just mention age-friendly communities. You know, our president said with age-friendly communities, you can't have age-friendly communities without age-friendly health systems, and that's how she got into that. But in some of the work we're doing, for example, in one of the states, we have doubled the number of age-friendly communities. So we recognize how important those are in the context of living. So again, thank you so much. It's just been a wonderful morning.
Look, thank you. And I just want to acknowledge Anna Sangster on the line, Program Manager of IFA, who is the Secretariat for the WHO Global Network of Age-Friendly Cities and Communities. So thanks, Anna. James, you have the last words.
All right. Well, thank you, Jane, and thank you again for the opportunity to be part of this town hall. I would just remind us all that there's a fundamental disconnect between what the experts in aging know to be true about aging and what the general public thinks. Experts see aging as something that should be embraced, and the general public sees it as something that should be battled. The general public thinks that there's nothing that can be done about aging, and yet experts in aging know a lot can be done. Decisions can be made, policies can be changed. We can indeed improve the lives of older people. And the public in general thinks that it's all up to the individual versus the fact that it's society that surrounds us that impacts us. We keep in mind there is this disconnect, and we can bring forward interventions to help change that. I would encourage all of you to think about this reframing aging work. It's all available on the GSA website, and we can begin leading from where we are now to change language we're using to push forward this longer term social change endeavor. And systemic changes, such as changing style guides, or such as changing a government policy, or even getting experts in aging to use the right framing when talking about aging when they talk to the news media. Those sorts of systemic changes can have long impact, long after the moment of the change. So I encourage you to think about where are those opportunities for systemic change inside your countries, that by making a tweak here, we can have long-term change in how people talk about aging, and again, ultimately, how policymakers make decisions around aging. Thank you.
Look, thank you very much, James, and it's been a pleasure to be with you.